In this video, I'm gonna discuss with you regarding toe walking. What is toe walking? Is it normal or abnormal? When do we need a treatment for toe walking? Hi, I'm Dr.V.P.Sivakumar, a senior consultant pediatrician and newborn specialist from Janya Child Clinic, Chennai, India. And this is our YouTube channel, and in this channel I'm going to discuss a lot regarding child health care, including child growth, development, behavior counseling, immunizations, and most often the early identification of diseases and home remedies, what all we shall do, will be able to do. And not only about childcare, but also a lot more on general health topics. So kindly do subscribe our channel, do like, comment and share our channel to your friends. We all know that toe walking is a normal phenomenon often observed whenever the kids learn to walk. Whenever the kids are in the beginning phase of walking, they do toe walk. This can be considered normal until the age of 2 to 3 years. If provided the growth and development of the kid is fine, we need not worry, we need not bother a bit also. But then in a few instances, we need to be of concern. Say in cases like where the growth and development are little bit affected, or else if the child is associated with cerebral palsy, a condition called a cerebral palsy, autistic spectrum diseases and muscular dystrophies. These are the conditions wherein the toe walking is abnormal. Let me brief. When do you suspect abnormal toe walking is if there was any complications during the childbirth, either during the pregnancy or after childbirth. Was there a hospital stay, a newborn stay, an ICU stay, wherein the baby has not cried, the baby was asphyxiated, meaning lack of oxygen and had some complications? In such babies, we need to follow up. In case if there is any toe walking, we need to go to a pediatrician or a pediatric neurologist, discuss with him regarding the same, and early intervention needs to be provided. In such a case, treating the underlying cause will correct toe walking also. So a physiotherapy and occupational therapy would be helpful in children associated with cerebral palsy. Autistic spectrum diseases has a certain linkage with toe walking. So what is autistic spectrum disease? You all know that that child will be having issues in social development milestones. The child will not be mingling with others. The child will not be responding to others' commands immediately or promptly. The child will be living in its world of own. The child will not communicate when we ask for, but might utter a few words when in need. And child will have some repetitive gestures and sometimes echolalia. Echolalia means repeating the words whatever we use. Say, what is your name? If we ask, the child also will repeat, what is your name? Had your food? The child also will repeat, had your food. Instead of replying to that, the child will just repeat what we say. These are the early signs, early cues or symptoms of autism. And if this particular child also has toe walking, then it is having a high likelihood of behavioral developmental issues, and we need to focus on this. When do you have abnormal toe walking? So in a case of a normal toe walking, the limb muscles will be normal, the posture, the tone, coordination of movements, all will be normal. Where abnormal toe walking, all these might be partially affected. Most often than not, there might be having a small Achilles tendon. There might be a stiffness in the muscle fibers. Say all the leg muscles or the calf muscles are fixed to the heel bone through a tendon called Achilles tendon. Some individuals might have a small Achilles tendon, so that in such cases the child needs to toe walk, stand on toes to provide the optimum support for the Achilles tendon. And in certain conditions called dystrophy, muscular dystrophy, the child will be initial stages of walking, the child would have been walked normally, and later on when the muscle starts degenerating, the child attempts to toe walk. So this is a very rare condition. It is a genetic problem, and in such a cases also we need to consult a neurologist for some help. In a severe condition of cerebral palsy or in condition of a global developmental delay, we will often pick up toe walking. But there are some children with toe walking with minor weakness, with a single limb involvement, or with a single hand or with a single leg involvement. There will be mild weakness when you observe when they are walking. They might be having a circumambulatory gait. That means the child will move his leg in a circular motion and then walk with toes. This could be a monoparesis. This could be a defect. So these cases we need to pick. These children we need to early identify and give supportive therapy so that the gait also improves, the power of the muscles also improves, and the toe walking also gets corrected. Okay, coming to the treatment. In cases of normal toe walking, the only treatment you need is reassurance, stating that the child, as he grows, everything will get corrected and need not worry. But in case of abnormal toe walking, we have to treat the underlying disorder by physiotherapy or occupational therapy, and the toe walking gets corrected on its own. In certain people, even with normal toe walking, they continue doing toe walking for a few more years, say 5 years, 8 years kind of. In such a case, we need to advise them regarding stretching exercises of the leg and the foot muscles. And in some scenarios, we need to use braces or splint to correct the toe walking deformity. Many often than not, toe walking runs in families. Either the kids' parents or siblings would have also been walking on toes, and in such case of idiopathic familial toe walking, nothing needs to be done. Kindly subscribe to our channel for more videos on child healthcare. Bye.